So hidradenitis is not known well, but there are many patients suffering from hidradenitis. It's a disease of the glands of our body, and most of the time the intertriginous regions such as armpits, groin region, like thigh region, our leg between our legs, or the buttock region, or nape of the neck, or the areas which are having hair-bearing skin can be affected from this disease. It's a very patients might suffer from this disease for long times. They might get some medical treatments from this for this symptoms, or after they diagnosed hidradenitis suppurativa. But if they cannot have any result with the medical treatment, they need to have a multidisciplinary approach. They need to reach their ideal weight. The body mass index has to be in the ideal measurements, and the patients needs to quit smoking if they are smoking. And the other conditions like thyroid diseases or metabolic syndrome or diabetes, they all needs to be evaluated. And then if we need to plan a surgery, we need to plan those surgeries after we check the patient and evaluate from all these kind of comorbidities. And what we can do for hidradenitis as a surgeon, as a plastic surgery point of view, we need to get rid of this unhealthy, affected hair-bearing skin from wherever it is affecting. So for the armpit, we need to debride all the unhealthy tissues, and we need to close that wound with a neighboring tissue or a skin. If we are talking about the leg, it's the same. We need to get rid of that unhealthy skin and close these wounds with a neighboring tissue. And also after the surgery, we want our patients to stay their ideal ways. They shouldn't gain weight after the surgery or start smoking again. So it's a life habit change. You need to change your life habits. For the patients that we treat, we can show some examples for the armpit region or for the buttock region. Most of the patients are suffering from the armpit, and by getting rid of this, by debriding this unhealthy skin, we can close that area with a tissue that we harvest from the arm. So by doing this, we also achieve an arm lift effect of the arm. So we can reduce the circumference of the arm, and we can also close these wounds with those tissues that we harvest from the arm. And we can also do the surgery for the thigh area, for the groin area, or wherever it is affected by this disease.